Dengue fever is a fever spreaded by mosquito bite. When Aedes aegypti, like mosquito, when it bites, particularly in the morning and in the evening, they are very brisk to bite human beings, and they are the one which carry the virus, dengue virus, and when it bites from one person to other person, it spreads. So dengue is a fever disease in the monsoon time. Dengue fever characterizes by 102 to 104 degree temperature, body pain, joint pain, and as a usual viral fever symptoms will be there. Initially, it does not differentiate from other fevers. After third or fourth day, it becomes hemorrhagic dengue. That is the one which has to be alerted. Hemorrhagic dengue fever symptoms like reddish eyes, reddish mouth, and nasal or gum bleeding, and blackish stool. All these symptoms are characterized along with reddish skin rashes for dengue fever. If a person is suffering from dengue, he has to go to the doctor, and a doctor can easily diagnose it with doing a routine fever test along with platelets counts. If the platelet counts are within normal limits, that is 1.5 lakhs to 4.5 lakhs, then he is not supposed to have the fever of dengue. If it is less than 1.5 lakhs, then the doctor can suspect about dengue. He can order for specialized dengue tests. If those tests also confirming with the dengue fever, then he may need to be hospitalized. If a child or adult old aged along with some other morbid illnesses like diabetes, hypertension, they have to be hospitalized immediately. Otherwise, if the patient is not toxic, if the patient is not having the hemorrhagic dengue symptoms, need not to be hospitalized immediately, but under the care of the doctor he should be. So when dengue hemorrhagic fever symptoms and also tests are positive, he has to be definitely hospitalized. In the hospital, the blood counts, platelet counts, if they come below 50,000 and the symptoms are there, then immediately they treat it with routine platelet transfusion. But for every patient, they may need to transfuse fluids. Fluid replacement is the core treatment in dengue management, because there is no treatment and there is no specific prevention. Both are not there, so it is only can be treated with adequate fluid overload and also platelet replacement if symptoms are positive. And how to avoid dengue? Dengue can be prevented only by avoiding mosquito bites. Mosquitoes are the only one which spreads the dengue fever. And how to avoid them? It's only by preventing mosquito bites by wearing a full sleeve or full pant, your dresses, or covering yourself well adequately to prevent from the mosquito bites. The other thing is prevention of mosquito breeding. For that, you have to cover all vessels in and around your home, wherever you store drinkable water. So they are spreading only in the drinkable water. We have to prevent them by destroying the place where they can be stored, or by applying bleaching powder or even kerosene oil in the stagnating clear water bodies. Inside the home, once you are infected with dengue, then you have to, with the advice of the doctor, you have to take plenty of fluids. That is the only thing we can do. And also, to bring down the temperature, you can use the paracetamol recommended by your doctor. And visit your doctor once in 48 hours, that is once in 2 days, and go according to his advice. And fourth or fifth day, if the fever subsides, even if it is dengue, nothing to worry. But if it aggravates with the platelet counts going down, and symptoms of dengue hemorrhagic symptoms are there, then treatment will be prescribed with admission in the hospital. So just be with your doctor, prevent mosquito bite, and take precautions to take more fluid whenever you fall sick with fever.